Hello and welcome to Chapter 12, Health and Aging. Today we're going to talk about health, more specifically, the issue of healthcare. Also, we're going to address the topic of aging. What are some of the factors that affect different groups of people's lifespan around the world? According to the World Health Organization, health is a state of complete physical, mental, and social well-being. Basically, health does not just address our physical body, but also our mental well-being, basically our mental health, and the relationships that we have with the people and the world around us. Healthcare is any activity intended to improve health. This includes nutrition, the way that we eat, exercise, plus the prevention and treatment of diseases that we might have. Medicine is an institutionalized system for the scientific diagnosis, treatment, and prevention of illnesses. This includes anything that helps us take care of our body to ensure that we live a long and healthy life. First, let's have a look at health in a global perspective. Life expectancy refers to an estimate of the average lifetime of people born on a specific year. Meanwhile, the infant mortality rate is the number of deaths of infants under 1 year of age per 1,000 live births in a given year. You can tell a lot about a country's health by looking at its life expectancy and their infant mortality rate. High life expectancy rates, basically when people live much longer, and low infant mortality rates, basically when you have very few babies dying, are a good sign of a country's health and healthcare system. Places like Hong Kong, Monaco, Japan, Italy, Spain, and Switzerland have some of the highest life expectancy rates in the world. Meanwhile, places like the Central African Republic, Lesotho, Chad, Sierra Leone, and Nigeria is considered to have some of the lowest life expectancy in the world. Let's have a look at some of the factors that do affect our health and our life expectancy. First up, let's have a look at sex. Women in general live longer than men. Gender roles and gender socialization also contribute to the difference in life expectancy. Why do you think this is the case? We're going to take a look at some of the factors in a short while. Race and ethnicity. According to the Department of Statistics in Malaysia, the highest average life expectancy is for Chinese females, about 80.2 years old, while the lowest is for Indian males, which is about 67.8. Although race and ethnicity do not directly affect your health and lifespan, cultural habits do. Things like food habits and lifestyle have a huge effect on our health. Health effects of disasters. A disaster is a sudden ecological phenomenon of sufficient magnitude that require external assistance. Different parts of the world suffer from different ecological disasters. Volcanic eruptions, earthquakes, typhoons, droughts, floods, and blizzards are just some examples of ecological disasters that affect different countries around the world. Fortunately, in Malaysia, we suffer from a relatively low number of ecological disasters. The most common ecological disasters that affect Malaysians are floods and the infamous haze. These two disasters have a major effect on our health and livelihoods. What are some of the other things that affect our health and life expectancy? Lifestyle factors that do affect our health includes heavy usage of legal drugs such as paracetamol, better known as Panadol in Malaysia, and painkillers, consumption of alcohol, smoking of nicotine or tobacco, better known as cigarettes, the use of illegal drugs such as cocaine, heroin, or even ecstasy pills, sexually transmitted diseases, AIDS, and diet and exercise. Together with our sleeping habits, these are some of the lifestyle factors that have a huge impact on our health and well-being. Next, let's have a look at the functionalist and conflict theorist perspective on health and healthcare. Functionalists view the sick role, basically the role of someone who is sick, as a set of patterned expectations that defines the norms and values appropriate for individuals who are sick and for those who interact with them. Basically, when a person falls sick, there are certain expectations and responsibilities for the person who is sick and the people who are around that person. Functionalists believe that people who are sick are not responsible for their condition. People who assume the sick role are temporarily exempt from their normal roles and obligations. People who are sick must want to get well. People who are sick must seek competent help from a medical professional to hasten their recovery. Basically, the belief is that people who fall sick are not at fault for getting sick. The people around them should try to help the person to get well by providing them with sick leaves, for example. Plus, the person who is sick must do everything that they can in order to get well. This includes seeing a doctor and taking the proper medication or treatment in order to get better. Meanwhile, according to the conflict theorist perspective, the medical industrial complex encompasses local physicians and hospitals as well as global health-related industries such as insurance companies and pharmaceutical and medical supply companies. Basically, they view the healthcare industry as a business. There are quite a lot of people that profit and benefit from your health and your healthcare. This includes insurance companies, pharmaceutical companies who do all the research and manufacture the medication, plus the businesses who are involved in supplying medical supplies and equipment. In modern day healthcare, our approach to medicine is basically organized around the cure or control of serious diseases and repairing physical industries, rather than the caring for the sick or preventing disease. Doctors and nurses are responsible for treating our illnesses and diseases. They may give us advice on how to better take care of our health, but they are not responsible for us taking care of our health and shaping our lifestyles. The modern day medical system is highly technological and specialized. The diagnosis and treatment of diseases around the world today usually involve the usage of some kind of expensive and high-tech equipment such as CT scans, X-rays, and other machinery. The medical care workforce can be pictured as a broad-based triangle with highly paid physicians and administrators on the top and little or no movement of lower-ranking workers and caregivers. What this means is that people at the top of the healthcare industry are usually given extremely high salaries, whereas those at the bottom, such as caregivers and even nurses, are usually given low salaries with little or very little room for advancement. Next, let's have a look at the topic of mental illness, a somewhat sensitive topic that a lot of people don't like talking about. Mental illness, a condition in which a person has a severe mental disorder requiring extensive treatment, differs from a mental disorder, a condition that makes it difficult or impossible for a person to cope with everyday life. Nearly 20% of adults aged 18 or over have experienced some kind of mental illness. There are many different kinds of mental illnesses around the world. Some of us might even be suffering from mental illness at a low level that we are managing by ourselves. Mental illnesses may be caused by genetics and environmental factors such as our relationships and our stress levels. Common mental illnesses include anxiety and mood disorders. People with mood or anxiety disorders frequently experience feelings such as nervousness, fear or sadness for the smallest reasons or even for no reason in particular. Someone might look at the world around them and suddenly feel like everybody hates them or the whole world is trying to bully them. Other common mental illness includes dementia, which is the degrading of one's mental functions, This usually happens to the older generation, but can happen to much younger people as well. A lot of young people today also suffer from some kind of eating disorder. People who suffer from anorexia or bulimia are people who, no matter how thin they are or no matter how little they eat, will still think that they are overweight, and sometimes will take drastic and extreme measures in order to make themselves thinner. Meanwhile, on the opposite side, people with binge eating disorders are people who just simply love eating. Now, of course, most people love food. But then again, you have those people who simply cannot stop eating, especially when it comes to sugary foods or fatty foods. Even though they may suffer from a high risk of diseases such as diabetes, stroke, or heart disease. Disability refers to a physical or mental impairment that substantially limits one or more major activities that a person would normally do at a given stage of life, and may result in stigmatization or discrimination against a person with a disability. Now, how do we deal with people with disabilities in our country? Are the environments in our society, such as shopping centers and schools, friendly to those who are physically impaired, such as those who are wheelchair bound or those who are hearing or visually impaired? What about people who suffer from mental disabilities? Do we have jobs or welfare that help take care of such people? Next up, let's have a look at health and culture. Can factors such as our healthcare facilities, our lifestyle, and even our education affect our health? Italy, Iceland, Switzerland, Singapore, Australia, Japan, and Sweden are the countries that are considered to have the best health profiles. Whether a population is healthy depends on quite a few factors. Do visits to the doctor or hospitals cost a lot of money? Does your country encourage and provide easy access to healthy activities and good nutrition? Life expectancies also differ markedly depending on occupation, wealth, education, and lifestyle. Of course, some jobs may be more dangerous or safer than others. Also, the rich and well-educated usually have access to better healthcare because they can afford to pay for it. Do you feel we should have a universal healthcare system? A universal healthcare system is the idea that everyone, regardless of whether you are rich or you are poor, deserve to have good access to healthcare. This may include the government creating policies that make things like insurance, clinics, and hospitals affordable or even free for the people. Whether universal healthcare is available or how it is available differs greatly depending on the country. Like, for example, in Malaysia, we do have polyclinics and government hospitals which are either free or extremely affordable. Whereas in countries like Canada, Denmark, and Sweden, healthcare is seen as something that should be free and available to everybody. Why do the poor have higher death rates? The poor suffer from poor health because of various reasons. Their problems range from having to work all the time and not having the free time to take care of their mental health, not having the money or finances to be able to afford good, healthy food, and in some countries, not being able to afford to go to the hospital even when they are sick. Death rates for those with a college education are considerably lower than those with less education, and particularly those who have not completed high school. Educated adults are less likely to smoke, and even if they do smoke, they are more likely to quit smoking and eat healthy. Those who are well educated usually have better opportunities when it comes to jobs in society. This allows them to earn a higher salary, which in turn allows them to take better care of themselves because it gives them more choices in life. Meanwhile, the poor and less educated have less choices in their life This causes a high amount of stress and sometimes not being able to make smart decisions. Next up, let's have a look at AIDS. AIDS, which is short for Acquired Immunodeficiency Syndrome, is caused by the human immunodeficiency virus, or HIV. HIV is a member of the retrovirus family and gradually incapacitates the immune system by infecting white blood cells. HIV is transmitted through sexual contact, piercing the skin with HIV-contaminated instruments, transfusion of contaminated blood products, and transplantation of contaminated tissue. Although there are different ways that people can contract AIDS, the two most common ones today are through sexual contact with someone who already have the virus, and through the sharing of needles when it comes to injecting illegal drugs. With today's technology, although there are ways to control and manage the virus in one's body, there is still no cure for the disease. Therefore, it is highly recommended that you use a condom when having sexual intercourse with someone that you are not that familiar with or someone that you don't really trust. The usage of a condom has been shown to be effective 95% of the time when it comes to preventing the virus from spreading. Next up, let's have a look at the topic of preventing illnesses. What are some of the things that we can do to have a healthier lifestyle and help prevent illnesses from happening to our bodies? We think of illness prevention involving at least these three levels. First up, we have medical prevention. This is directed at the individual's body. What is it that we do to our body? Do we eat healthy? Do we exercise regularly? Do we take steps to ensure that our body is well taken care of? Secondly, we have behavioral prevention, which is directed at changing people's behavior. Is there anything that you regularly do that may be harmful to yourself? Do you smoke? Do you drink alcohol? Do you have a healthy amount of sleep every night? Do you take part in activities that helps you relieve your stress, such as spending time with friends, watching movies, playing video games, and doing activities that involve some kind of relaxation? Structural prevention is directed at changing the society or the environments within which people work and live. Think about your daily activities and the world around you. Do you work in a stressful environment? Do you engage in activities that bring you more stress than enjoyment? Do you spend a lot of time and have relationships with toxic people? Basically, people who yell at you all the time or people who have negative impact in your life. Is there anything that you can do to change any of these things? This is of course a lot easier said than done. Depending on your financial, family and health conditions, you may or may not have the chance to change your life. Once you have graduated from university and have secured a good job, that is the best time to take control of your life. Keep in mind that sometimes the older you get, the harder it is for you to change your life. Therefore, it is important for us to cultivate healthy activities and relationships while we are still young. Here's a question. Can your friends make you fat? Can they make you fit? For many of us, the activities in our lives revolve around our friends. What do you and your friends like to do? Do you enjoy doing sports activities like playing football or badminton? Or do you enjoy going out to have a good meal or watch a movie or play video games? Try to get a group of friends or a few group of friends to ensure that you enjoy a wide variety of activities in your life. And finally, we look at the aging population. What are some of the factors that affect our life expectancy and our health as we get older? There are demographic and medical reasons for the growth in the older population. The older population come from a variety of racial and ethnic backgrounds. The older generation generally suffer from poor health. With the help of modern day technology, even though the life expectancy for both men and women has increased, the increase has been much greater for women. Why do you think the life expectancy for women is greater than for men? Let's have a look at sex and their influence on a person's health and life expectancy. Women in general outnumber men in every age category among the elderly. This means that women generally live much longer than men. Women at any age are less likely to die than men. Both women and men suffer from a variety of diseases. Women are more likely to suffer from diseases such as breast cancer, ovarian and cervical cancer, pregnancy issues, and depression. Meanwhile, men are more likely to suffer from heart disease, lung cancer, stroke, and diabetes. Statistically, men also commit suicide at a much higher rate compared to women. Why are men more likely to die than women at any given age? Women are more likely to seek aid when in distress. Compared to women, men are less likely to cry and ask for help even when they are in trouble. They are afraid that society might look down or make fun of them for being not strong or not manly enough. Men are more likely to take on more dangerous jobs like carpentry and construction work. Jobs that require a lot of physical strength like carpentry, bricklayers, or taxi drivers are usually dominated by men. These jobs are usually a lot more dangerous and may be hazardous to one's health. Men are more likely to be put in prison. Compared to women who commit the same crimes, men have a much higher chance to be put into prison. And we all know what a dangerous place prison is. There are approximately 105 male babies born for every 100 female babies, but higher male death rates cause the sex ratio to decline as age increases. Females outrate males in Malaysia about 107 to 100. Depending on the country, male may outnumber females or the other way around. For example, in countries that are at war, females usually outnumber males because most of the males have gone out to fight as soldiers and many of them are killed in battle. In China, because of the one-child policy, today males outnumber females about 114 for every 100 females in the country. There are 3 women for every 2 men aged 65 or older. Among those over 85, there is only 1 man for every 3 women. As you can see from the statistics, most women tend to outnumber men. Marriage is important for the older generation for several reasons. The presence of a spouse, a husband or a wife, and children provides a variety of resources in the household. Married elderly are less likely to be poor, to enter a nursing home, or to be in poor health. Spouse and children are primary caregivers for their partners. Women are more likely than men to outlive their spouse because they live longer. For life expectancy of women, this disparity is also caused by the fact that men tend to marry women younger than themselves. So, based on what you have learned today, what do you think? Are you taking good care of your health? Are you on the right track to be living a good, healthy life for yourself in the future? Is there anything that you can do that can improve your quality of life? Are you taking steps towards it? Why or why not? A lot of young people nowadays spend a lot of time either enjoying life or improving themselves in their career, not realizing that health is so much more important. Having a good job and a good income gives you better access to healthcare. But there are some diseases which are better if prevented or cannot be treated no matter how much money that you have. After everything that you have learned in this module, I hope that you are doing everything you can in order to live a healthy, happy, long life. And that brings us to the end of this chapter, and with that comes the end of this module. Congratulations for making it this far. I hope you find that things that you learn in this subject to be useful for you in the future and will help you in making life decisions and in your jobs. Thank you very much for joining me. It's been a pleasure, and I hope to see you again in the future. Bye-bye.